With COVID coming along and the fact that it really seems to adversely impact the aged population much more than the general population, we wanted to see if we could make a difference there. What we did was take a look at drugs that had previously been used in humans that were proven to be safe and ask the simple question, can they inhibit the main viral protease of the virus that causes COVID-19? And the reason we wanted to look at drugs that had previously been used in humans is, in the middle of a pandemic, you don't have time for the normal course of drug discovery. I mean, that usually takes years to decades to go from concept to approved drug. The reason we chose the main viral protease is, previous viral drug discovery work had shown us, shown the field that the protease is really an Achilles heel for many RNA viruses. And it seemed likely that was going to be true for SARS-CoV-2. So we started to do some work, and many others are doing related sorts of work, looking at the main viral protease and trying to figure out how to inhibit it. Because if you can block the main viral protease, you will stop viral replication. The most potent hits that we identified were all related to hepatitis C viral protease inhibitors. And so several of these are approved drugs that have been used in the clinic for quite some time to treat hepatitis C. The real question is, will these drugs be potent enough to actually act as an antiviral in an infected patient? And we have done no work of that kind. We're all, focused in test tubes. But, the fact that you've got an approved drug that was known to be safe and has antiviral properties for other viruses, makes it a relatively short leap to do some trials and see if they actually work in human patients with COVID-19. It's estimated that there's about 20,000 compounds that have been used safely in humans. And we've screened about 7,000 of them so far. So the goal is to screen the remaining compounds. We've started those screens already, but we've got a ways to go. Obviously, the human tragedy is enormous, and we all want this to end and hope for treatments. I would really like to go back to my work, solely focusing on dementia. But I think as long as the pandemic is ongoing, we've really got to contribute as best we can to the developing treatments and ending the pandemic.